kind of piggybacking on what we talked about with the original neural signals from the medullary and pons center, we're going to look at some of the pulmonary reflexes that you have that create abnormal and different breathing patterns for you guys. So these are the 4 listed here that we're going to talk about. The first one is the Brewer reflex. And so it's got 2 components. The first component is like the inflation reflex. So this is where you have receptors in the walls of your bronchi and bronchioles. And what it does is as you're breathing in, and you can kind of imagine your lungs are expanding, right? As you're taking a breath in, that thoracic cavity is getting bigger. These receptors sense that stretch, right? They have things that can kind of send out a signal with that stretch. And when it gets to be a certain point, they will limit the inspiration. So this is the Brewer inflation reflex. As your lungs are expanding, these receptors are going to sense that stretch. They're going to send out a signal when it's appropriate to limit that inspiration coming from those DRG neurons. The second component is this deflation reflex. So this is a little bit more of an intense one. So in situations where you have a very rapidly compressed or deflated lung, or over a period of time, like with atelectasis, these receptors will realize that they're not stretched enough, right? They're shrunken down, and what they do is they will increase your respiratory effort and your respiratory rate. So that's why a lot of times when somebody has either atelectasis or lung collapse, they get this very rapid, shallow breathing pattern, and that's coming from this Brewer reflex, particularly on the deflation side. These stretch receptors recognizing that they're not stretched enough, that something's going on, and so they're going to trigger a more increased respiratory effort. Okay, so then you get that shallow, rapid breathing. You have something called the irritant reflex. This is subepithelial cells in your trachea, bronchi, and bronchioles have sensory abilities. So they use the vagus nerve as well. Again, you guys are not going to be responsible for these pathways. I'm just including it. And these subepithelial cells and sensories are activated by compression, deflation, like gases, pollen, solutes, anything that's irritating when you breathe it in. So you guys have all probably had this happen where you breathe in dust or dry air for a long period of time, or you cough when you smell like paint thinner or something like that. This is all coming from that irritant reflex. And what it'll do is it'll increase your respiratory rate. It'll cause a cough or a sneeze. In severe cases, like people with asthma or irritants like water, like drowning, it can cause bronchoconstriction. So your bronchioles can actually close up or narrow, or it can cause laryngospasm. So if you think about how that could help to keep the irritant out of your lungs by spasming or closing down. Now, the problem with that is if you have a little bit of bronchoconstriction, that can cause like a cough, whatever, that's normal. If you get a lot of bronchoconstriction or a lot of closing off of your airways, that can be a really big problem, obviously, because you can't breathe. So the irritant reflex is good. It's protective, but it can sometimes go too far. I don't know if you guys have ever heard about something called a dry drowning. So this is a phenomenon that tends to happen in younger or small children where potentially if they went swimming and they were under the water and they sucked in water and had almost like a sort of drowning episode where they were pulled out of the water and they're fine. There's these rare instances where hours later they have this irritant reflex kick in where they actually have really severe laryngospasms or bronchoconstriction and their airways actually close up, and this has gotten those kiddos in some real trouble where they've had to be rushed to the hospital and they aren't able to breathe, and it's because of this irritant reflex, almost like overcompensating after the fact, and they call that a dry drowning. So generally speaking, the irritant reflex is pretty minor, serves to protect our airway from having any sort of like foreign kind of substances come into it, but it can obviously get a little bit more serious depending on what it's exposed to or what the circumstances are. You have something called J receptors. it stands for this juxtapulmonary capillary receptors. They're located in interstitial tissues between your capillaries and your alveoli. So if you guys can kind of imagine the diagram of your alveoli, and then right underneath it is obviously your capillaries, these receptors are located in the space in between those. They're stimulated by alveolar inflammation. So you can think about like the scarring and different things that can irritate your alveoli. Pulmonary vascular congestion, that's just a fancy way of saying that anything like pneumonias or exudate or anything, infection, anything that's kind of in the alveoli that doesn't belong in the alveoli, that's congesting it or blocking it. And then edema. So that can be edema caused by fluid, or that can be edema caused by, when we talked about blood can sometimes back up into the lungs. That's all going to be something that's going to stimulate these J receptors, these juxtapulmonary capillary receptors. And their response is very rapid, shallow breathing, shortness of breath or dyspnea, and then it causes this glottic narrowing on expiration to cause grunting. And I kind of want to take a second to explain that. So one of the accessory muscle things that you guys learned is grunting. And the reason that that becomes something that people utilize when they're short of breath or when they're having a hard time oxygenating or ventilating in general is because when you narrow your glottis, if you think about where your glottis is in your airway, if you narrow that, you create something called back pressure. All right, and that grunting that you hear actually creates back pressure. This is really common in babies when they're working hard to breathe. You'll see this kind of grunting. And what this back pressure does is it tries to work to stent open those alveoli. So if you can think about this kind of linking up with the potential for the alveolar inflammation or congestion or edema, if all of that is in your alveoli, it's going to make that alveoli want to collapse down, which is obviously not something we want for ventilation and oxygenation. So what your body will do in response to that is they'll create like this grunting or this glottic narrowing, and the hope is that that pushes that back pressure and helps to kind of stent open those alveoli and combat whatever's going on, whatever abnormal thing is going on to collapse them. So that's something I really want to draw your attention to, because this is a symptom you're going to see particularly in your peds population and your babies, but you do see it in adults as well when they're really short of breath. They literally on exhalation will grunt, and it's a way of trying to help open their lungs open and keep those alveoli stented open. The other response that I want to talk about is a vasovagal response. This is something that involves sensory and motor vagal components. It's considered like a laryngospasm or a bronchospasm. It can happen where it causes a patient to cough really intensely, or you can have a severe vasovagal and it can actually affect your heart rate. It can cause bradycardia. So where I think that this comes up a lot as a respiratory therapist is if you have a patient that you're intubating or suctioning or performing a bronchoscopy, and that's all where you're going down into their trachea, down into their airways, they can have this thing called a vasovagal response. And in severe cases, it really can cause them to pass out, or their heart rate can get very dangerously low. It's not really 100% understood why. It's for some patients, this is something that happens versus others. But one of the things as a respiratory therapist, whenever you're performing some of these more invasive procedures like intubation, suctioning, or bronchoscopy, this is something that we always look out for so that we can pay attention to if that's kind of a side effect that they're having, so that we're more careful if we have to do those later. So if we have vented patients, one of the things that we do when we do our cares is we usually will go in and suction that patient because they have a breathing tube in. They're not able to remove their own secretions very well. So we'll go in and we'll suction. Some patients, you have to be very careful with that because they will have this vasovagal and it will affect their heart rate so much that it can be dangerous. So this is something that we pay attention to, and it's called a vasovagal reflex. So that's kind of the explanation for that one. Two other ones that we're going to talk about really quickly is you have these peripheral proprio receptors. These are found in muscles, tendons, joints, and pain receptors. This is something that kind of is a direct response to your ventilation, in the sense that if you're moving your muscles more, these little proprio receptors are going to send signals to cause hyperpnea or deep breathing. So you could think of these as when you start to run, these are all going to fire in your muscles and they're going to send stimulus that says, oh, we better start breathing more. If you are exercising, these are going to fire and get your ventilation kind of kicked into gear to make sure that we're meeting those body's metabolic needs. The other thing that almost all of us can relate to is these also fire if we're having a lot of pain, or you could think of if you've ever been shocked with cold water and it's really hard not to go right away. That's all coming from these peripheral proprio receptors. That's where this signal is originating. And then the other one that we're going to talk about is the head's paradoxical reflex. The only thing that you have to know about this is this may be what maintains your large tidal volumes during exercise and deep sighs, yawns, things like that. And then there's a theory that this may be what is responsible for babies' first breaths at births. That's really all I want you to know about this. I've had more detail in the past. I don't really think it's warranted. So this is what you need for your flashcards, and that's really it. These are your lecture questions. As always, if you have any questions, shoot me an email.